New cases are still popping up around the world on a daily basis. In mainland China, at least 132 people have died.
There have now been more than 128,000 cases of COVID-19 in the state, and 2,337 Arizonans have died from it.
I always remind people that every statistic is a story. Every statistic is a family member. Every statistic is somebody who died or somebody whose life will never be the same, and all the family members that are now suffering because of it.
Lauren Leander is an ICU nurse in Phoenix. Back in April, she confronted anti-mask protesters who mocked public fear of the coronavirus.
We were just starting to figure out how to take care of these patients, what that was going to look like, how we were going to rearrange our hospital to compensate for that. And then meanwhile, there's these protests of 3,000 people with no masks. So it was really just trying to bridge that gap between, hey, this is my reality, I hear your reality, but there's something else going on here.
Leander was especially worried about her Navajo and Hopi patients who had higher rates of infection.
Probably at the time that we were at the protest, I would estimate about 60 to 70% of our patients in these COVID ICUs were Navajo and Hopi. And so there was this huge discrepancy between who was getting sick, how sick are they getting, what are their chances of survival. On one unit, we had a father and daughter in neighboring rooms. We had, an uncle and an aunt and a grandma in another unit. Like, we had entire families at our hospital, which I've never seen before.
Leander and her friends organized a GoFundMe page to buy COVID-19 relief supplies for hospitals and patients on the reservations.
We were able to just work with them, reach out to them, ask them what they needed, and then kind of streamline our money into where they saw the greatest needs to be. Because obviously we're a little removed from the reservation.
They worked with a nonprofit supply network called Navajo and Hopi Families COVID-19 Relief Fund.
When she was sending those items to the hospitals, it coincided with our Air Bridge program, where we were flying items from Phoenix into different communities. And so we were able to fly some of the items that she needed to transport to the local communities, and then our volunteers handed off those items to the hospitals. And then the other half of her donations are being dedicated towards the isolation kit materials for the COVID positive individuals. And that's being done directly through our organization.
AirServe International sponsored the Air Bridge program and flew 24 supply flights from Phoenix directly to the Navajo Nation.
Our communities are very far apart. Logistically, it's challenging to move things where they need to go. Being able to fly them was really, really helpful in making sure that a significant amount of relief items were able to make it to these remote communities and be disseminated as quickly as possible.
Public health experts at NAU are studying the spread of COVID-19 in Arizona's rural populations. It's clear that the virus is exposing gaps in our healthcare networks.
We're part of 6 rural counties in the north, and we had one epidemiologist for the entire region. The systematic disinvestment in rural America has also really compounded the ability to address COVID-19 in a systematic, coordinated way in rural places, because the resources just aren't there.
Early in the pandemic, members of our team, including Dr. Sabo, Dr. Camplain, other faculty, and several of our students, started assisting the county health department in surveillance and contact tracing. We also reached out to our regional Native nations to assist with grant writing for our COVID-19 relief funds. And since then, we have received funding from the Flynn Foundation to conduct a study entitled The Epidemiological Modeling to Facilitate Regional Response to Epidemic Threat.
The NAU scientists and Lauren Leander all agree that the best strategy for partnering with tribal communities is to follow the lead of local grassroots leaders.
What was really important for us in our work was working with them. we all of a sudden ended up with this huge pile of money, and we're really struggling on what to do with it and what that was going to look like. We realized these communities already had their own relief efforts in place, and they were really, really good.
We have a system down. We know what we need to order to feed, a community of 100 people. I mean, my hope is that, the country can wake up a little bit in terms of the inequity that exists in Indian country, because really, we should have the same percentage of paved to dirt roads as anywhere else. That really impacts, again, the delivery of medical services, the ability of our children to go to school on a regular basis, and just so many things that build upon each other and further exacerbate the equity gap. So hopefully, things will change, and as people learn more about what that gap looks like. And as we've seen with COVID, that gap unfortunately has made Indian country particularly vulnerable, and has life or death consequences for people living in these communities.